Think about if you do like a really good core exercise and like your abs are sore, how many times during the day do you notice that? You notice it right away when you get out of bed, when you're pushing, when you're moving around, when you're stretching in certain ways. So that's how it's going to be for this person that you're taking care of.
Hi everyone, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm Dr. Smita Ramanathan and I've got Dr. Ashley Amalfi, my dear friend and co-host with me. Hi Ash.
Hi girly. Hi everyone. Thanks for tuning in. Hi caretakers.
Exactly. This one's for you.
Yes.
So we are continuing our series all about caretakers, the friends and family that are helping our patients recover well at home.
So thank you. Thank you for volunteering.
Yes, thank you. Because
voluntold that you are the caretaker after someone's surgery.
Your job is very, very important, but we're here to make it a little bit easier and more stress-free.
Yeah.
So last week we covered breast surgery, so make sure you tune into that if you haven't. And this week it's all about the tummy. So tummy tucks, mommy makeovers, pretty much anything where you're getting surgery on your abdomen. And so this is going to be a little bit more demanding, maybe, of you caretakers, unfortunately, compared to breast surgery.
It's
but
more
we're going to
major.
go through everything.
It's a more major surgery. I mean, think about like if you've ever had abdominal surgeries. When you're touching the belly, it's just a little more sensitive. I mean, especially what we do, Smita, we're tightening muscles, and it's really that muscle tightening that's sore for most of our patients.
Yes.
If you've had a C-section, sometimes I'll say it kind of feels like that, or any other belly surgery. Your belly is just sensitive and sore, and so that's
we use our belly, right?
For everything.
That's also part for everything. Getting up, sitting down. I mean, our core strength. We really use it for more than what we think we use it for, which obviously makes recovery a little bit more, right?
Think about if you do like a really good core exercise and like your abs are sore, how many times during the day do you notice that? You notice it right away when you get out of bed, when you're pushing, when you're moving around, when you're stretching in certain ways. So that's how it's going to be for this person that you're taking care of. So for the first few days, they're going to need a lot of help moving around, because getting up, getting out of a chair, getting out of the couch, the bed, that's all going to be really hard for them without their core. So they're going to need to kind of lean on you and need that support to get out of bed, to get up to the bathroom. So you're going to want to be there, be prepared with everything you're going to need in those spaces, because you're really going to kind of be holding their arm and assisting them places around the house, I would say, for like the first 2 days. And then after that, most people are kind of figuring out how to do it on
turn
their own.
the corner.
Right. So
I mean, you have to, especially for our tummy tucks, right? Where they're bent over for the first few days, really cannot put any stress on their abdominal muscles.
Remind them that, because sometimes people are like, I can stand up, and your job is to make sure that they're kind of bent over, like kind of like an old lady.
They're just hunched
walking
over, like using a little cane, right?
Yeah.
Except don't use the cane. But
yes, you don't need a walk or anything. Just like walk bent over. You don't want to put incisional tension there, right? So when they stand up, they pull on that incision. You want them just kind of leaning over and comfortable. So remind them of that. What else? Let's talk about the garment. Yeah. So they're going to be in like a girdle looking thing, which is a little more to take care of than a bra. So a lot of times they have a hole in the crotch so you can pee. And so you can use a shiwi so that you don't get it wet. But they can do that. But if they have to have a bowel movement, you should probably take that garment off, because you're going to make a big mess out of it. So as a caretaker, you're going to be on duty for that. And it might be a few days after surgery, but just be aware. You take that off, and then you take it off to shower too. So you want to help them in and out of their garment. It's really hard to put that on alone.
I mean, that's definitely like a multiple person.
Yes.
Definitely a 2-person job.
This is your job. But you're going to be really good at the little hooks.
The little hooks, right? Or and even if you have an abdominal binder, right? You still need 2 people
to put
that's
on
essentially
well.
just a big elastic band, right? And so to wrap that around and to have the right amount of tension and support, you'll definitely need to be there to help with that.
Sometimes
but other
easier,
than that,
easier to lay in bed to do some of that stuff too. And also your patient is not going to get lightheaded. So sometimes when it's time to put that stuff back on, just lay it out on the bed, get them right on top of it. And then you can pull the binder, you can pull up the garment, a little bit easier for them if they're just laying down. And that's like a good trick. Not a lot of gauze.
That's
not a lot of gauze for these things. Just like the breast surgery, a little gauze along incision lines you'll have. And again, you only really need to change those if they're getting yucky and really bloody, and you want to call your doc if you see that too. So there's not a lot of incisional care. How about drains? We should talk about drains. Yes.
Yeah, I was literally just going to say that. Yeah, so I mean, I use drains for my tummy tucks. Do you, Ash?
Yes.
Yeah, I just think it just gets rid of the swelling and helps you heal faster.
Yes.
But the drains are they're annoying. I think everyone's scared about drains. They're not painful, but they involve some help and some care during the recovery process. So really the biggest thing is to make sure they're empty, they're measured. That's a good job for their caretaker to do, especially the first couple of days when your patient, your loved one is groggy from anesthesia. They're not going to be, feeling comfortable or with it enough to measure everything. And that's the most important thing that determines when we can remove them. Keeping the area clean, making sure the bulb on the suction, is always on suction.
Maybe we'll do a whole episode on this at some point.
We should do one for drains, actually,
we'll bring some in, you guys. Stay tuned. We'll do a little drain episode, but the nursing team's going to show you how to do this. You're going to see it before you have to do it on your own. You just want to be organized, make a little chart, make sure you know what's coming out of there so that you can report that to the doc. But yes, they're not going to be able to take care of their drains the first few days. Eventually they'll be mobile enough and with it enough to do it. But for the first few days, that will be one of your jobs. You're going to stress about it, but you're going to do fine. No one ever fails at this.
You're going to do fine.
You've got it.
And then in this and then always make sure it's pinned to clothing, either the binder, compression, a t-shirt, just so they don't drop.
Pulls. Yeah, that pulls. If it pulls on the skin, it's just
that's
uncomfortable.
Annoying.
Yep. So you just want it suspended
and then in the
somewhere.
shower.
Yep. Something around their neck in the shower. Yep.
A little lanyard or something. That's always helpful.
It's not that hard. We'll help you.
But you guys got it. Yeah.
But
I know the good thing about the drains, they have the little loops too. So you can just you don't even need to get a lanyard. You could just get a string, anything. A little rope, just something around your neck.
Ribbon, anything. But yes, we've got you. If you're a caretaker, don't stress. You're going to be fine. You've done harder things. Just be there, be prepared. Don't let them do too much. That's your job. Just let them really take it easy, and you help them and assist them in all things those first few days, and they're going to be back on their feet in no time. So we're excited. We're grateful that you're helping our patients.
I know. You guys have such an important job.
Yes,
but
they love you. That's why they chose you. So don't stress. And then we will see you next episode. We're going to talk about a few more procedures, and we'll keep educating you as well. So make sure you subscribe on YouTube, Spotify to Lipstick and Lipo, and we will see you guys soon.